Tonight we're going to talk about something that's near and dear to Danielle's heart.
Yes.
And that is developing the hat, which essentially is developing the job description. So in Hubbard parlance, we're talking about developing the job description so that it's a foolproof job description that anybody can come in and anybody can do it. Danielle essentially took this system and she just ran with it, and you're about to see the results. So anything that you want to say before we start?
We will be talking after the video, because I know the video is going to sound like, which it is, it's a very big project, but afterwards I'm going to show you how to get it started. It's so easy and you can do it so fast with your staff. So afterwards, please stay tuned because we are going to go over that.
So here it is, the hat system.
Hi, I'm Dr. Lee Sheldon, founder of the American Association of Independent Periodontists.
And I'm Danielle Dorner, I'm co-founder, and we had put together these videos because we wanted to put together a visual for everybody to see exactly how we do each one of these modules. We've done webinars, we've done teleseminars, and this was our way to show you exactly how we do it. We found that we are actually going to use these for our own staff and training, and we hope that you guys can find this just as valuable.
So we hope you will enjoy these videos. What happens when a new employee comes in? What happens when one of your key employees is out and somebody has to fill in? How do you handle that situation, handle it effectively? Well, the way we handle it and the way we recommend we handle it in the Hubbard management system is to create a hat. That's a hat. And a hat essentially is a description of the entire job, and I mean a complete description of the entire job, so that in fact a person can read a section of that, know what he or she has to do, and then perform it right away.
And that way the hats are in our office is there's actually two separate hats. There is a hat for the front desk and there is a hat for the back. And the way that we have these designed is, well, the way we had these started was, and it goes back to the org board, and the org board we'll cover in a different video. And what we do is we have everybody assigned to an area of the practice, and everybody has a few assignments. It's their responsibility areas. And once you establish who's responsible for what in the practice, you have them write up what to do in that area. So in the hats, what we have is, you have the table of contents at first. And for the table of contents, it shows exactly what you're going to find in the hat. So for the front desk, it's going to be things like answering the phone. It's going to be starting the day, ending the day, taking a message, just everything within that particular job. So one person's job may be Lisa. Lisa greets patients when they come in. She signs them in. She checks them in. She collects payments. She checks patients out. She makes appointments for the patients. That's her job. But if Lisa's out for the day because she's sick, somebody else needs to take on her position. Maybe it's me. Now, I've been here for a long time, but I don't do Lisa's job every single day, so I could probably do it, but I probably won't do it very efficiently. So if I have Lisa's hat, I can sit down at Lisa's desk and go, okay, this is what Lisa does. Okay, she's checking in the patient. What does she do when she checks in the patient? Okay, so she writes their name down. She notifies the assistant that the patient's here. She writes a check-in slip so the assistant can come get that and know what the patient's for. Coming in for. She can, offer the patient coffee, offer them water. She does all these little steps that I may not know about. So looking at her hat and reading that, I can check off and know exactly what she does for that patient. When the person in charge of that area is writing up their hat, they're writing up, okay, this is what I do when the patient comes in. This is what I do when the patient's checking out. This is what I do while the patient's waiting. This is what I do if, for chance, the assistants are running late. So everything's in there. One, it's an explanation form. So they can read and go, oh, okay, this is what she does. And it sounds great. Also, it's in check sheet form. So I can check off the check sheet for every patient. And I can know, okay, I did it. I know for sure that I did it because I just checked off everything that she has me doing. So it's foolproof. It's really, really good. So within this, let's say that Lisa's just out to lunch and something happens within her job and I don't know how to do that. So I'll look up real quick in the table of contents, okay, this is how she does that. And I'll read over it and go, oh, okay, this is how she does it. Maybe it's copying a CT onto a disc. I know we do it, but I don't know how to do it. But I can read her instructions because I have done it before and go, okay, I remember how to do it without saying, hey, Jennifer, who's the manager of the front desk, how does Lisa do a copy of that disc? So now I'm interfering with Jennifer's job to say, hey, excuse me, stop your job for a moment so you can help me do Lisa's job. Instead, I can open a book and I can follow it and I can see exactly how she does it. Nobody gets interrupted. I efficiently can do her position. So it's great for someone who's just starting, someone filling in. And it's also great just for reiteration. For example, in these hats is a start of the day and an end of the day. And I require, even though you've been there for 10 years, I require those check-in of the days and check-outs of the day go into my box so that I can tell Dr. Sheldon, yes, Lisa came in and she turned on the water, she turned on the coffee maker, she unlocked all the doors, she turned on all the computers, she checked all the messages on the answer machine. I know that she did it, so if Dr. Sheldon says, Miss Smith called today and she was upset because she said she got the message on the phone, on the answer machine, and nobody got back to her. I can look at the check sheet and says, well, Lisa checked all the messages and there wasn't a message from Miss Jones on there. It's just something must have happened. So it stops the, hold on, let me go ask Lisa how she did her job this morning, and just very chaotic. It makes everything very smooth and very efficient.
Good. And so it's important to be able to write up the hats. And who's the most qualified person to write up the hat? It's the person who does it. And so when we're going through the writing of the hat, by the way, we update these every July.
Every July.
Everyone is required to update their hat because, you know, things change over the year. You know that. And so essentially it is a very minute, stepwise process. Let's assume that, for example, we're assisting in surgery. And you know what it's like to set up an operatory for surgery. Okay? And that essentially means that we talk about where the instruments are, how they're set up in the tray, when we grab which particular instrument for which particular procedure. I mean, it's in that minute detail so that somebody who's training can pick that up right away. You know, a new employee it'll take a while to train, but at least she knows what she needs to do and can review it. And if, by the way, if there are mistakes, and we all make mistakes, that's part of life, then all we have to do is say, well, let's go back and read page 4 of your hat. And let's go through that checklist and see where things ought to be done. And then the staff member says, oh, that's what's supposed to happen.
Yes.
Oh, the Explorer is done before the probe, or whatever it is. And so we keep on reviewing the hat and keep on refining our thought process until we've learned it.
Every staff member knows that the most frustrating part of training is that verbal kind of, well, what's this? How do you do that? Can you show me again how to do that? It's very frustrating. And so with this hat, it does eliminate that. So for example here, this is the assistant hat. And on here you can see this is for implant surgery. So what I said by being able to check off is it says everything that needs to go into the setup bucket. So right now we are training somebody in surgery. We have Courtney, which has been here for a long time, training somebody who's never done dental before, which is my favorite new hires because they get so excited. So she can say to the new girl, she can say, listen, this is what I put into the bucket. So when you're ready to do it on your own, just pick up this sheet of paper and you can know what goes into that bucket. So the girl's looking at this paper and going, oh, okay, I see all this stuff going into the bucket. So then they take this bucket to surgery and they set up the surgery. It also has what to do after the procedure. So it says this is for an implant surgery, they take a PA, they write up the progress notes, they notate what materials were used. It gives an example of how to write up a progress note so the girl can see exactly the format to write up a progress note. It goes over how to do the transaction. It's a screenshot of the computer. So it shows completing the transaction. So everything is in here from start to finish. And it goes over afterwards doing that, what to do in different scenarios. So everything is in here. So Courtney can show the new hire one time, looking at this hat, how to do it. The next time she does it, all she has to do is go, oh, okay, I remember Courtney saying that. Oh, yes, I remember that. Everything is in here, and we try to make it very, very easy. So there's a lot of information in here, but it's made to be a reference to make it very, very easy to follow.
By the way, doctors, it's important for you too.
Yes.
You know, if we're doing a procedure the same way every time, and most of us do, and particularly as periodontists, there are only a limited number of procedures we do. There's no reason why we can't have our own little checklist and let everybody know what order we do things in as well, in order to be able to allow the assistant to then understand what she needs to do in order to be able to assist us better.
Yep. And like I said, all these systems that we're talking about, it takes a little work in the beginning, as you know, I mean, as you can see, it's a pretty big hat. It takes a little work in the beginning to get these systems in, but once they're in, updating them once a year, having everybody responsible for their position and being held responsible with these check sheets, it makes everything flow so much better. So things are more efficient. Staff is much happier, less errors, less forgets, which makes for a much better day for everybody.
The less you have to do in quality control, the better. The less we have to catch up for what we missed, the better. The hat is a real good way of making sure we get it right the first time.
And we have, as we had mentioned before, I have front managers and I have back managers. At the end of the week, Jennifer, who's our front desk manager, she gives me a file. And in that file are daily check sheets, start of the day check sheets, end of the day check sheets, and during the day check sheets. She also has end of the week check sheets, and those check sheets are from everybody in her department. And that way, the people that she works with, her team members in that area, know that she's turning these check sheets into me to review with Dr. Sheldon. So it's accountability. They know, okay, I'm going to be held accountable for this stuff. It's not a bad thing. They just want to be sure that they finish it because it's going to go to me. It's going to go to Dr. Sheldon. And so everybody is working with that. Okay, I'm doing my job. I'm completing my job. I'm completing my steps. There's no error. There's no way for people to not do that. But they turn it into me every week in a file along with a report that shows me how things are going in their area. So
think of what the opposite of that would be. The opposite of that is micromanagement. I have to go into every particular employee's area to make sure that staff member is doing what needs to be done. And how can you concentrate on patient care when you're doing that? So instead, by our designing the system the way we want to, and by the way, doctors, this needs to come from you first. Danielle can implement what needs to be done, and Danielle's really, really good. But she needs to have some direction from me, and there has to be some consistency in the direction that I'm giving her, because we all thrive on systems. We all work on systems, whether we're cooking breakfast or whether we're working in a dental office. We have a particular system. And if we designed, if Danielle knows what I want, and I may help her with the system, more often than not, Danielle, in fact, creates the system because, frankly, she can think better from the staff member's viewpoint than I can. But as long as I let her know what needs to be done, and I'm consistent in what I'm doing every day. Imagine if I tell you to do something one day, and then I say, no, do it this way, and then do it that way. Then she has to recreate systems each time I change my mind. So as long as we've created a system that works, that's workable, that works, then she can develop the system that will allow me to do my job better. Now, if there are changes that need to be made, then there's always mid-course corrections. I might say, you know, I'd rather use PRGF instead of EDTA. Okay, that only means that for you, you say, well, in step 7, get out the PRGF or process the PRGF in the way we ordinarily do it, rather than use EDTA. PRGF is plasma-rich growth factors, which is blood that we take out of the arm and spin it down and get the platelets. And those of you in periosurgery, many of you know what I'm talking about. Essentially, it's to enhance healing. EDTA is a chemical that we use for sometimes for similar purposes. But as long as we're doing that, then you can design the system. You can go to the staff member. The staff member then reads it and says, okay, I know that step number 7 now needs to be this rather than that. It's plugged right into the hat, right in the computer. Print out a new sheet, put it in the 3-ring binder, and we've got it.
And that happens daily. It does happen daily. I mean, things are always changing. They're always finding easier ways for things to work, or more efficient ways, or more successful ways for things to work. And as we had spoke before, being the practice manager, I'm the buffer between he and the staff. So he may be in a surgery and he may be frustrated that there's too many forceps on the table. There's too many forceps, there's too much stuff, it's too confusing. Assistants are stumbling, trying to find the forceps that I'm looking for. Here's what I'd like. For this particular extraction, I want forceps A, B, and C. That's all I want, nothing else, not all that other stuff. So he'll tell me about that. So what I'll do is I'll give a note to Courtney and say, can you please change in the hat for extractions? Just have forceps out A, B, and C, and don't have all those other forceps out. And what she'll do is she'll change the hat. So she'll change the hat, it'll be a correction. I'll give a note to everybody saying, correction for extractions, we're now gonna have forceps A, B, and C only, and refer to the hat for all the changes, and it's updated. Every day it's updated. So we'll do that right away. So it's always changing.
Sure it is.
Things are always changing in there.
And there are times that Courtney will say, He may think he uses only forceps A, B, and C, but let me tell you, he asked for D and E 5 times this week. So what he thinks is going on really isn't going on. What's Courtney going to do? Courtney is going to write that up, put it in Danielle's communication box, saying, here's what's really going on. Then Danielle's going to look at that. Then she's going to come and she's going to talk to me. And then I, being the boss, can change my mind and say, all right, I guess she's really right there, and Courtney is really right. So then I say incorporate D and E, so I have at least my input saying, all right, I guess I was wrong, oh gee. And then I give it to you, and I say, I'm writing, here's what we ought to do. Then you give it to Courtney. Courtney then, Danielle approves it, and then Courtney approves it.
Correct.
So that everybody in the system is thinking with it, and that's how changes are made.
Well, you said before, the best person to create policy or create an organization for an area is the person that's actively doing it. So really, Courtney does know what works best for surgery. Dr. Sheldon does make changes, but Courtney does know because she's running surgery. She knows what Dr. Sheldon's always asking for. She knows the frustrations and the barriers that we are coming into because she does it all day long. So when she does say, I understand what Dr. Sheldon's saying, I understand he only wants to see forceps A, B, and C, but reality is he does use, D quite a bit. So maybe the handle may be, listen, I'm just getting frustrated with seeing everything there. You can have the forceps in the sterile packs to the side, but let's not open them all up right away. And if I call for them, they're right there, open them right up. So a lot of times we do that. And instead of you verbally saying something in the surgery, offending an assistant, they get upset, they start crying, they want to go home.
Never happens.
Never happens. We make it to where he comes out of the room, written to me, please handle this. I'm going to talk to Courtney and handle it, and then go back to him and handle it. It's all done behind the scenes. No one's getting upset. And we find a plan that works, because after he cools down a little bit, then we do find a system that does work. So that's really the key is, for one, the real plan that does work, we want to have written and in this book.
So you want to keep your staff happy? You want to keep your doctors happy? Write your hat.
We hope you have enjoyed this video. If you have any questions in regards to it, please email us.
The American Association of Independent Periodontists is there to help every periodontal practice do better. I'm Dr. Lee Sheldon.
And I'm Danielle Dorner. We'll see you on the next video.
So that was our video on the hat, and Dr. Sheldon wanted me to make sure that I did say to everybody he is a very nice doctor and nobody ever gets offended.
Thank you. It's a public service message.
Yes. It's always good at the end of the day. He's good. So anyways, how do you start this hat? How do I get one of these things started? The way that we got it started initially is we kind of had a hat started, but it wasn't an effective hat. And how we did that was get your entire team together for a staff meeting. And you create defined duties of who does what. I hear a lot of offices say, well, we all do everything. We all do it together. It's a teamwork thing. You are going to do everything together. You are going to work together as a team, providing teamwork to get things done. But you give everybody a list of responsibility areas so that somebody is responsible and accountable for everything. So sit down together during a staff meeting and have everybody write out, what is your job duties? What are you responsible for doing every single day? And what we did is, once we got these lists, the managers and doctors got together to clean up the list and give everybody a true defined list. What we found with that is even though everybody in the department is together providing teamwork, doing the same thing, one person may be responsible for machines, one person may be responsible for ordering, one person may be responsible for stocking. Now they all may do it together, but one person is responsible for it. So who do you find that's responsible for what? You together decide on who's better at doing it or who has more time within that day to do it. One person is responsible, one person is in charge. Different departments, different parts of the office, it's all responsibility. So I have a list in front of me of I have a piece of paper for every single staff member that I have and a list of what their responsibilities are so that I can always keep track of this. If something changes, they give me the new paper to update it. So my first person I have here in front of me is Hannah. Hannah's duties are 1, PRGF. That means that she runs PRGF all day long. She knows how to process it. She knows how to separate it. She knows how to put the membranes together and get it back into surgery. So her hat write-up would be how to do the PRGF process. Hers is a surgical runner. So it would be, what is a surgical runner? What do you do when you hear the beep? What do you do when they need this or that? So it's surgical runner. Sterilization lab and maintenance of the equipment in the lab. So she would do an individual write-up for how to maintain, to do the cleanup and weekly maintenance of every single equipment, the LISA, the Statum, the cold sterile. She would do a write-up for how to do every single one of it, how to sterilize the surgical kits, how to sterilize the sharpening stones. Everything is in there. So it's a pretty big project for her, but that's what she has to do. Laundry, end of the week maintenance, and assisting in unpacking and ordering supplies in the office. Now, she is not in charge of actually doing the ordering, so she wouldn't do a write-up on that. Another person's job duties descriptions may be for surgical assisting. So she would have a pretty big job as well, because she has to write up how to prepare for and set up every single surgery that we do. Periodontal surgery, implant surgery, sinus lift, bone graft, tissue grafting. So she would have to do one for every single one of those. She's also in charge of stocking rooms 2, 3, and 6, send back failed implants, send parts to other dentists for the uncoverings, surgical logbooks, materials, and drills, the surgical equipment, end of day and end of week checklists, and post-operative checks. So she would do a write-up for every single one of those. So we first do the defined list. Then you have everybody write up exactly how to do it. So if somebody were to come into that department for the very first time, how would you walk them through doing it? So for implant surgery, like we said, the very first thing would be a checklist. Be sure you have an implant kit, suture holders, the implant drill, the implant motor. You have all your stuff listed out so they can put everything in the surgical bucket. And the second one would be how to set it up. Now that may include taking some pictures of the setup to easily guide the staff members on how to do that. So that would be the completion of the hat, because they're not going to write up how to do the surgery. They're not doing the surgery, they're assisting, but it would be how to set that up. And that is how you effectively get that hat going. So you have everybody write it up, you get it together, and then like we had said before, twice a year we do the updates. We do a big one in July, and we do a kind of a cleanup one in December. So every July, it is mandatory by the end of July, you have to go through your hat, sections of your hat, and you have to update the sections of your hat, and we do check those. And that's how you get started on doing your own hats.
It's really important to understand that we're moving into a new era of dental delivery systems, and part of this has to do with systems themselves. You've got to be in a position where you are creating a business, because corporate entities know this. The good corporate entities know this. And we're going to have to compete. Not compete with the corporate entities in terms of quality. We know where we are in that. But certainly in terms of efficiency. So while things like this may seem to be a chore, once you get this put in, once you get this part of the system put in, then essentially you're running more like a business, running more efficiently, certainly have staff that's happier, has management that actually has a system by which he or she can verify that the staff member is doing the job that needs to be done, and the staff member can be more independent because all she has to do is read the hat. And if the hat's written really well, then she knows how to do her job. So that's it for this particular section, the hat, and we'll be back with you again next week. Treatment planning session next Wednesday at 8 p.m. And the 7 critical elements to the successful periodontal practice at 9 p.m. next Wednesday night. Look forward to hearing from look forward to hearing from you all during the week, and anything you need, just let us know.
Have a good night.